Hi, my name's Emma,
And I'm Chloe.
and today we're going to be doing our presentation on dementia. So, what is dementia? Dementia is not a specific disease by itself. In general, it's just a term for the inability to remember, think straight, or just make day-to-day decisions for everyday activities such as getting dressed, remembering to turn the stove off, just simple things like that in life. So, the most common disease that most people know of relating to dementia is Alzheimer's. It's talked about quite frequently, but dementia as a broad term isn't completely understood.
So, how dementia really affects the brain? It's basically categorized under forgetful disorders. It happens when abnormal brain changes occur. They can either happen super fast or super slow. It really depends on the person. These abnormal brain changes trigger decline in thinking skills, that is also known as your cognitive abilities. These changes can be severe enough to impair your daily life things, just as things you could do a month before, like getting dressed. These changes can also affect your behavior.
So, why does it happen? Dementia results from damaged nerve cells that interfere with communication between the cells in the brain. So, when brain cells cannot communicate with one another, thinking, behavior, and feelings can all suffer. The brain becomes less functional as more nerve cells are damaged.
So, some of the things that we found that can help you and your loved ones with dementia is music. Music can express feelings that they can't verbally sometimes. According to research, music has been found to be beneficial to people with dementia in improving their general attention, their thinking, their memory, their speech, and their communication skills, as well as reducing agitation and depression in them. While there's no cure for dementia, there have been mechanisms that are used effectively. Patients listening to music is one of just those mechanisms.
Another mechanism is talking about memories that remind them of their past. So some patients who suffer from dementia, they sometimes are stuck in the past and not in the present. So there has been a really strong correlation between reminiscence therapy and improved moods, well-being, and behavior in those with dementia. It relates to discussions about past events, activities, and experiences using artifacts such as photographs and music. For example, my grandmother was diagnosed with Alzheimer's about 3 years ago, and she was stuck in the past. So she thought that she was younger before she had like my mom, and so things that we used to would like remind her to kind of bring her out of a aggressive stage that she would be in was talking about her past experiences with jobs and family. So that's kind of what we're getting at here with the talking about memories.
Some other things that can help are sensory toys. They can help actually with their mobility in their hands and their arms, and sometimes, depending on what it is, with their feet and their legs. It also helps like desensitize them. So Alzheimer's and dementia patients frequently benefit from sensory stimulation, which keeps them in the present and makes it easier for them to interact with their surroundings going on. In recent studies, sensory stimulation has shown to be useful in treating memory problems. By engaging the 5 senses and offering different forms of communication, seniors can see some improvement in their daily functioning.
So not only is dementia hard on the patient itself, but it's also hard on family members. So I think it's really important to remember that there is therapy and support groups. That's definitely one thing that you need to remember, is it's not just their health you have to worry about, it's yours as well. So having a family member go through dementia is really difficult on them, but it's so hard on yourself as well, and sometimes that doesn't get talked about as much. So therapy sessions or support groups are recommended to help you get through the hard times. It's not easy having a family member be diagnosed with dementia, especially as it progresses. It's also a lot of pressure on someone to take care of a dementia patient. I know for a really long time, my mom took care of my grandmother, and eventually it was so bad that we did have to put her into a nursing home. It was just too much for one person to handle, and I think it's really important to remember that, because a lot of people feel like they have all this pressure on them, but there is a lot of supports in our community for that, and it needs to be recognized.
Yeah, as my mom, she's a CCA, and she always reminds me, like, people need the help when they're taking care of their loved one with dementia because they don't realize how hard it is on them and how burnt out they get.
Yeah, I completely agree with that. It's very difficult. Speaking from my own perspective, my grandfather recently has also been diagnosed with dementia, and it's a lot to process for not only them but you as well.
So sometimes they can feel isolated. In a study of 300 individuals living with dementia, it was found that 64% of them felt separated from their companions and family after they were determined to have dementia. This is reasonable given the idea of the sickness, as a different investigation of the overall population uncovered that almost half, so around like 41%, would feel disconnected, assuming they wouldn't perceive their friends and family anymore.
So as it progresses, they can become very angry because they feel helpless. So for an example, my grandfather, he was living alone until a couple months ago, and he was angry, he was lonely, he felt like he couldn't do anything by himself anymore. And I think that's a really hard idea to wrap yourself around, because it takes a lot out of someone to have to ask for help, and it's hard. So it can leave them feeling miserable and furious, which is completely understandable. Rather than doing things that could help them with their diagnosis, such as exercise or clubs or religious activities, they stop attending them out of humiliation. Typically, they don't want help and get agitated and aggressive when offered it. Fatigue can also play a role in causes of aggression or outrage. And I think it's also very important to remember the things that we talked about earlier with calming them down, because it's not as easy as telling them to calm down, like it's okay. You have to kind of go into more depth with it.
And not just them being angry, but it takes it like mentally, it takes a toll on their body physically. Many individuals with dementia, particularly in the later stages, wind up remaining in bed or sitting in a chair and just not wanting to move anymore. This implies that they are in danger for bed sores. If you notice a bed sore or have any concerns, you should probably address your family doctor immediately. The individual should be urged to move around however much they are capable of. For instance, through helping for walk or seat-based activities, like a physiotherapist can help with this.
I think it's also important to touch on the topic that they get very depressed sometimes, because if you put yourself in their shoes for just a second, you have to think about how they're feeling, and if they're forgetting things and pulling away, they're gonna need some emotional support throughout it. Even though it can be hard and they can try and argue with you or fight with you, you think you just have to kind of remember that what they're going through, it's a lot, and it happens so quickly that it can definitely be very hard.
Yeah.
So thank you for watching our presentation.
If you guys have any questions, just comment them below, and if we don't know the answer, we will definitely get back to you about it.
All right, thank you.